as you know, Senator Kennedy died just a few days ago, and I wanted to make a few comments about him because nobody had more impact on our national, on so many of those issues I just talked about. No single elected official had more impact, with the possible exception of Franklin Roosevelt, than did Edward Kennedy. He's left us, his death robbed us of a remarkable force for social and economic justice. A couple of stories I want to tell about Senator Kennedy, because I was privileged enough, because you gave me the privilege in 2006 of being your United States Senator. I was privileged enough to get to call him a friend in the last 2 years plus of his life. He was in December of 2006, he chose me as one of 2 freshman senators to put on his committee, on the Health, Education, Labor, Pension Committee. That's the committee that's written the health care bill this year with the strong public option that I worked on with Senator Kennedy. But when he put us on his committee, he put me and another freshman on, he invited us to his home in Georgetown. I'd never been to Georgetown, I'd never been to his home. And I, of course, invited us to his home, the 10 Democratic senators on the committee. And I sat there in his dining room, and I was sitting at the end of the table, and to my left, the other freshman's name was Bernie Sanders. To my left at the table were all Democratic senators on his committee. It was Ted Kennedy, Hillary Clinton, Barack Obama, and Bernie Sanders. And I sat down, I looked over, and I said to Bernie, "What the hell are we doing here?" And it was pretty clear what we were doing here, because we were part of the tradition of this committee that had passed so much of that legislation I talked about that had made such a difference in so many people's lives. More than 1,000 laws that Ted Kennedy signed onto on civil rights and workers' rights and disability rights, on consumer protection, on the environment, on education, provided millions of working class Americans with a sense of optimism and hope and a much improved standard of living. Today, despite misinformation, despite tired dogma, intimidation, and fear-mongering, we will fight like Ted Kennedy fought to make sure that we fight for a healthcare system that works for all Americans, not just I think a decreasing number of people that the healthcare system seems to serve. The statistics are pretty sobering about where we are in healthcare in this country. Most people are generally pretty satisfied with their health insurance. I understand that. That will continue under whatever health plan we send to the president's desk. But increasing numbers of Americans who have good health insurance, or at least thought they had good health insurance, are finding that their health insurance is not so good when they get serious kind of cancer, and they're spending $40,000, $50,000, $60,000 in biologic drugs to combat that cancer. And they bust the cap, if you will. They go over the annual or the lifetime limit of their insurance coverage, not knowing that it was a lifetime limit, and they end up in bankruptcy. More Americans, the single most common reason for Americans declaring bankruptcy is health care, and the single most the largest number of people who have declared bankruptcy because of health care expenses are people who had insurance. It just wasn't insurance that they thought it was as good as they thought it was. And we also know what's happened with costs. Since 2000, average family premiums have increased by 92% in Ohio. So in effect, in the last less than a decade, people's insurance premiums have doubled. 20% of middle-class families in our state spend more than 10% of their income on health care. And these numbers were before the most recent recession, before the layoffs at Lordstown, although I know people are being called back, but before the layoffs in other plants around this state and around this country. 390 people every day in Ohio lose their health insurance. 12,000 people every day in this country lose health insurance, but in Ohio, it's 390 people. In the Mahoning Valley, it's dozens and dozens every day lose their health insurance. In a more personal way, let me tell you a story of someone I met just 3 days ago. In Cincinnati, a young 17-year-old high school student came to an event we had, and she told her story. 17 years old, her name is Rachel. She stood up courageously to share her story in front of a lot of people, and she told us that that her father carries the gene that indicates a fairly high probability of breast cancer. Her mother's side of the family has been afflicted with with autoimmune disease, several different autoimmune diseases over the last couple of generations. And Rachel said, and she looked at, she said, I'm very healthy. She said, I go to the doctor once a year on my parents' insurance, and I get a checkup, and there's nothing wrong with me that anybody can determine. But she said not too long ago, her parents' insurance company told her she could never get insurance because she had a pre-existing condition. And imagine a healthcare system that tells a young woman who has shown no signs of illness except she had the unlucky draw of parents who had illness, that she was not going to be able to get health insurance. My guess is everybody in this room could point to cases, their own situation or a relative situation, almost for sure, and if not, friend situations who have been denied care, who have been discriminated against because of gender or age or geography, who have seen their insurance canceled because of they went over the annual cap or the lifetime cap, who have been disqualified for a pre-existing condition, who have been denied care, who perhaps own a small business and with 30 employees and 2 of them get very sick and their insurance premiums are no longer affordable for the whole business as a result, even though they did nothing else, they did nothing wrong. All of us know people like that in this healthcare system. The status quo in healthcare is working for the insurance companies, but it's not working for Ohio families. It's not working for business. It's not working for large businesses. And part of GM's problems is terribly onerous healthcare costs. It's not working for small businesses, people trying to start a business, in Niles, or trying to start a business in Mespo or Champion or anywhere else in the valley, and simply can't make a go of it because of healthcare costs, or have to start the business and just pray to God every day that neither they nor their family gets sick. Health insurance companies under the law today are allowed to charge women more than they charge men. They're allowed to charge premiums sometimes 15 times higher for older people than for younger ones. They not only blatantly discriminate based on gender and age, they use pre-existing conditions to deny coverage for people who needed health care in the past. There are even otherwise reputable health insurers who rescind coverage from families who've already paid thousands of dollars in premiums. All of these sound like stories, I'm sure, that are simply far too common that all of you have heard. We do this reform bill right, and in a moment I'll tell you why I'm optimistic that we're going to. Reform will help every small business owner who has been forced to lay off workers or cut back on coverage because it was unaffordable. For the millions of seniors or pre-Medicare retirees, reform would help you keep your employer retiree benefits and would lower your insurance costs. Health insurance means the health insurance plan we're working means you'll have choices. Private insurance company choices or a public option, your choice among the menu of plans and the coverage you want and that you can absolutely rely on. Increased competition in the private insurance market will drive down premiums and improve quality. In several counties in Ohio, 1 or 2 insurance companies control more than 80% of the market. That's why it's so important to have a public option. That's why it's so important to bring more competition into this system, real competition, not what we've seen in the past. If it weren't so serious, it would amuse me that I hear insurances when there's talk of the public option, the option that when people choose what insurance coverage that they want, they can choose Cigna or Aetna or Medical Mutual, basically a not-for-profit in Ohio, or they can choose a public option, whatever they want. It's sort of amazing when I hear insurance executives who ad nauseum preach that government can never do anything right, when they say they're against the public option because the public option will be so efficient that it will put them out of business. I mean, which way is it here? And it really is a case where with Medicare does, they know Medicare operates more efficiently than private coverage. Private coverage has, all this, private coverage has administrative costs 20, 30%, oftentimes, almost always over 15%, often as high as 20 or 30. Medicare's administrative costs fall far below 5%. And insurers and basic insurers are afraid the public option will be so efficient that it will force them to do things they don't want to do, cut lower profits, cut into executive salaries. The CEO of Aetna last year made $24 million.